I'm Dr. FakhriRavari, and this is a series of pharmaceutical calculations practice problems to prepare you for the NAPLEX. So if you look at the NAPLEX content outline, which you can find on NABP's website, you can see that if you go to page 4 or 5. Show you page 5. So if you go to page 5, they have all the different domains. So you will see that domain 1 is foundational knowledge for pharmacy practice. And if you look at bullet point C specifically, this is for pharmaceutical calculations, which includes patient parameters or laboratory measures, quantities of drugs to be dispensed or administered, rates of administration, dose conversions, drug concentrations, ratio strengths, osmolarity or osmolality, quantities of drugs or ingredients to be compounded, nutritional needs, and the content of nutrient sources, biostatistical, epidemiological, or pharmacoeconomic measures, and of course pharmacokinetic parameters. So here's today's problem. A 32-year-old patient, Alex Johnson, comes to your pharmacy with a prescription for a medication that must be dosed at 2 mg per kilogram per day orally, taken once daily for a 30-day course. Alex weighs 154 pounds, and the medication is available only as a 50 mg tablet. As the pharmacist, your task is to ensure Alex receives the correct number of tablets. So here's the question. How many 50 mg tablets should you dispense for the full course of therapy? So the best approach is to use dimension analysis. So essentially, you can take 2 mg per kilogram per day and write it as 2 mg in the numerator, and then in the denominator you have kilogram times day. So make sure you get that right. Milligram in the numerator, kilogram and day in the denominator. So that means that we need kilogram in the numerator to cancel the units. However, this patient is given as 154 pounds, so we need to convert pounds to kilogram. So essentially, if we need kilogram in the numerator, so we can say 1 kilogram is 2.2 pounds, and then we put the patient's weight, which is 154 pounds, so you put that in the numerator. So essentially this kilogram and kilogram cancel out, and this pound and pound cancel. And then the next thing we have is essentially every tablet is 50 milligram. So we need to get rid of this milligram in the numerator. So you will say that we will put the 50 milligram in the denominator to cancel that. And we can say this is one tablet in the numerator. And so you know this milligram cancels out with this milligram, so the only thing that's left is for how many days, and we are going to do 30 days. So if you multiply this by 30 days, so days will cancel, and then you will get essentially 84. If you type this into your calculator, or if you do it by hand, you should get 84 tablets. Now, unfortunately, this is the wrong answer, because what you basically ended up doing is that this gave about 2.8 tablets per day, and you know, we cannot really take a portion of a tablet. So essentially, before you do the 30 days, you actually want to get the math here so you can round it to a full tablet before you get to the 30 days. So essentially, if you do the 2 milligram per kilogram times day, so essentially you do all of the same things. So 2.2 pound times 154 pounds times one tablet divided by 50 milligrams. So don't multiply by day, and this will essentially be about 2.8 tablets. So essentially you can't tell the patient to take 2.8 tablets per day, so of course this is going to be rounded to 3 tablets per day. So this should be per day. So you can check this kilogram and kilogram cancels out, pound and pound, milligram and milligram. So you're left with a tablet per day. And then you will say 3 tabs per day times 30 days. That will give you 90 tablets. So this is the correct answer. So you want to dispense 90 tablets, not 84.